Cholera is an acute bacterial infection caused by ingestion of food or water contaminated by the gram-negative, coma-shaped bacteria Vibrio cholerae. It is transmitted via the fecal-oral route and is mainly linked to inadequate sanitation and insufficient access to safe drinking water. And as you can guess, it is most common in developing countries. When ingested, the bacteria has an incubation period of about 12 hours to 5 days, and it works by adhering to the intestinal lumen and causing the release of the cholera toxin, which then causes iron and water secretion into the intestinal lumen. This then causes profuse rice-watery diarrhea, which may be accompanied by fever and vomiting, and eventually leads to rapid dehydration, which is the cause of death. Not everyone who ingests the bacteria gets the disease, but for those who do get the disease, it has a mortality rate of 1 to 3%, and this can go as high as 50% if unprepared, so for example in war or ecological disaster. Before we speak about treatment, we need to speak about prevention. How do you prevent it? There needs to be enough education. There needs to be good hygiene and sewage disposal. People need to make sure they drink safe water. If that's tap water, that means boiled. And people need to make sure they cook their food well and eat it hot. Although the disease is deadly, it is relatively easy to treat, and people need to make sure they report to the hospital as soon as they experience any symptoms. On the way to the hospital, patients need to start taking a mixture of half a teaspoon of salt, 6 teaspoons of sugar, and 1 liter of safe drinking water. At the hospital, they'll be treated with pre-prepared sachets of oral rehydration solution, as well as antibiotic therapy. Since 1998, cases have been reported in the country, with significant morbidity and mortality in affected regions, especially in the low-lying flat and flood-prone southern region. Cholera is endemic in Malawi, with seasonal outbreaks reported during wet season. The current outbreak started in March 2022. On the 7th of November, it had been said to have affected 27 of the 29 districts in the country, originating mainly in the southern region, particularly in Sanje and Machinga, but mainly affecting the northern part of the country. 5 districts accounted for 78% of the reported cases and 68% of deaths. The most affected age groups were 21 to 30 years old, with males being disproportionately affected. It has been the largest outbreak in the country in the past 10 years. Malawi has since then implemented a national cholera response plan, strengthened their health surveillance system, strengthened their health system with aid from the World Health Organization, and started a reactive vaccination program. Make sure to like, comment, subscribe.